In the next case study, Laura Mutti, a physiotherapist from Mantova, Italy, from the Rehabilitation Hospital, describes a case where a woman has axillary web syndrome after mastectomy and sentinel node biopsy. The woman has sentinel lymph node biopsy on the right side on the 21st of January, and then on the 4th of February has a bilateral mastectomy with bilateral breast implants. In this case, the patient does not undergo chemotherapy or radiotherapy. Approximately 9 weeks after the surgery for the mastectomy and breast implants, the physician writes in the medical file, "The patient suffers from chronic venous insufficiency. AWS, which is axillary web syndrome or cording, are present from the right axilla, which is the armpit, to the elbow, forearm, and wrist. The pain hinders the complete abduction and flexion, which will refer to the shoulder movement. At horizontal abduction to 90 degrees, the elbow cannot extend fully due to the tightness of the cord and pain. The pectoral muscle also plays a part in this, and the restriction is that the patient cannot reach behind her any further than horizontal abduction. This is the position of maximum shoulder flexion, and again, there is a restriction in elbow extension, so not full extension can be gained due to the tightness of the cords. The blue arrows indicate the cording, and the red arrow indicates tightness of the pectoralis muscle. The physiotherapist commences the treatment immediately, as the pain from the cords make it difficult for the patient to work. The thick cord at the elbow is visible but not painful in this position. After treatment, it is separated into two smaller cords. The treatment required 8 sessions of 45 minutes, every day for 4 times, and then once a week over 4 weeks. The treatments consisted of energetic stretching of the cords. It was painful, but the range of motion improved immediately. Many popping sounds were heard during the stretching by the therapist. Occasionally, a few little bruises appeared without repercussions. The patient was always able to maintain improvements with exercises at home. At the 8th session, which is 8 weeks after the program was commenced, the patient can, in the left-hand photo, reach up with the arm beside their ear without causing pain, and on the right photo can reach out the back without feeling pain. The blue circles are just confirming that the elbow can achieve full extension in these positions of the shoulder. The woman was able to return to work. There wasn't any problem in her daily routine. Now she is continuing the exercises at home to maintain the results. She knows that she can contact the ward if she needs further help. These are the 3 exercises this patient used at home. Number 1, a stretch against a table or a bed. She flexes her back to feel a little more tension with the pain being bearable, and keeps this position for a few seconds and then release. The patient was advised if she did not feel a stretch, then this was the position that she would use for a stretch. She keeps this position for a few seconds and then repeats the sequence for 10 times. The third stretch requires the person to stand in the corner of a room with the arms in a held up position against the wall. From this position, the patient tries to touch the corner with her nose. It is a tricky stretch to do. The face and the breast move forward, but the hips stay still. When this stretch causes no tension, then the same stretch is done with straight arms. This protocol was used for a patient who had axillary web syndrome after mastectomy and sentinel node biopsy. There was no cancer detected, there was no chemotherapy, and no radiotherapy.